Welcome to The Beauty Shift, proudly sponsored by Keranique.
For thicker, fuller hair at every age and every stage of a woman's life.
I'm Michelle Phillips.
I'm a celebrity stylist and beauty expert, a national TV personality, and self-confidence coach. And over the years, I've worked with some of the most recognized faces in the world, helping them look and feel their absolute best inside and out.
That ultimate inner outer wow. Now that's true beauty, my friends.
Welcome back to the show, my beautiful friends. It's so wonderful to have you here with me today. I'm excited about this show because I have to say, a lot of times I go out, with friends or attend dinner parties or different social events. And by the end of the night, either women are kind of scooting closer and closer to me, asking me about what to do with their skincare, what to do about their hair care, specifically like hair loss, what to do about their makeup, all these, their bodies changing. I get a lot of questions about what to do, ingredients to use, treatments that work, and so on. And one thing that's really coming up, this topic, a lot, especially with women over the ages of like 40, it's about plastic surgery. I thought, I would address these questions today with my dear guest. He's a super cool guy. I was introduced to him a while back, and I really like his work and his approach to what he does. His name is Dr. Anil Shah, and he's an internationally recognized board-certified facial plastic surgeon. He's an educator, and he's also an innovator who's helped redefine what modern aesthetics look like. And what I like about his work is that it's not about creating perfection. It's about creating harmony and honoring women as individuals. Getting educated is super important, because if we're not educated, then we could make choices that aren't right for us. So that's why I'm excited to have Dr. Shah here with us today. And so I can ask questions on your behalf about what empowered choices we can make about our appearance without losing ourselves in the process. So please join me in welcoming Dr. Shah to the show. Dr. Shah, welcome to The Beauty Shift. Thank you so much for taking time out of your very busy schedule to join us. I appreciate it.
Michelle, thank you so much for having me on your podcast.
I love your approach, and I really have been looking forward to this conversation, because this is a topic that comes up most of the time around the dinner table when I'm at dinner parties. Women find out I'm in the beauty industry for over 20 years, and they start, scooting closer and closer. And then by the end of the night, they're asking me all kinds of questions about skincare, hair care, makeup, and plastic surgery treatments. This is something that I feel like secretly most women wish they could have something done, but they are afraid because they don't know if they're going to look like themselves. Or a lot of women have things done and they don't want to tell anybody because they're afraid of what people will think. And I would love to remove that judgment zone and just be in this like free zone where it's like, you know what, do what's right for you. And if you want to keep it to yourself, great. But I mean, why do so many people get so caught up with this like push and pull of, should I get something done? I don't know if I should. And just this kind of like internal dialogue they've got going on.
There's a lot of emotions that come up when someone like has the vulnerability to make a change for themselves, and they say, "Hey, I want to change something." Because I mean, just to kind of step into someone's office, I always try to put myself in someone else's shoes, and you have to put yourself in a vulnerable position, because you have to say, "There's something about myself that I want to fix," and it can be kind of hard. And this can be a sensitive topic for a lot of people. And they're like, it broaches a lot of things. It's like, hey, maybe I don't like myself, which isn't true. I think the reason people make a change is because they do like themselves, but that's like a whole other topic. Maybe there's something wrong with me. That's not true either, because everyone's going to have a change in their neck. Everyone's going to have a change in their face. They have something that maybe they just don't like. It may not be working as well as they want as well. So it brings up some sensitive issues for a lot of patients. But and then there also the fear. Whenever you do something that's fearful, when someone's working on your face, I think the stakes are just so much higher because um, it's right there for everyone to see. So if something is off even a couple of millimeters or it's pulled a little bit too tight, um, people are going to know that something's just off. And
Right.
so all of these things come into play. And lots of times we see bad plastic surgery. We can spot bad plastic surgery, but guess what? We can't spot
Yeah.
really well done, subtle plastic surgery.
Right. Because you don't know most of the
Exactly
time.
right. And
Yeah.
that's the part where you look at someone and say, wow, she's really aging gracefully. Like she looks so good. She's doing all the right things and she didn't even need plastic surgery. And then you find out later on she's had a facelift, neck lift, lip lift. So there's a lot of things that kind of come together. And it's being able to kind of create that change. I think when you think about especially aging face, like trying to make someone look younger, for example, it's really about trying to make someone restore to who they were, not to who they are.
What is the best age to really start to explore that? Because I've heard different recommendations, like starting in your 50s. Don't wait till your skin is too lax, so you see such a difference. I mean, what's your experience in working with your clients? Is there a certain age, or does it matter?
I think it's based on your anatomy and when do you start to see these changes. And there's patients who start to see changes in heaviness in their eyes in their early 30s. They might have puffs underneath their eyes, and they might say, "Well, maybe it's safe for me to put filler under my eyes." In reality, that's not the case. If you have a puff and it's there, and you want to take care of it, sometimes just fix it in the office under local or general, whatever you want to do. But a lot of times, if you go to a skilled surgeon, they can do under local anesthesia. The puff is gone forever. You don't have to worry about it, and voila. So I think the change is based on when your anatomy starts to show things that you don't like. It's worth having that conversation, and it's worth exploring. Is there anything non-surgical we can do? But oftentimes, surgery's in right now. It's not less about non-surgical stuff. A lot of times, it's just fix it and move on.
What do you recommend in terms of, like, for example, you were talking about, you can get some filler or you can do this or do that. But my experience in working with a lot of my clients that get filler, it's like the amount of money they spend over time. And it's just like trying to keep up with the filler. And it's, eventually it starts to fade and then it starts the sagging again. Is it better to just kind of lay off the filler and go straight into, well, if you want to have a lift, just get the lift instead of injecting um, often?
I think this goes into where like what the person's issue is and what's the best answer. And so I actually think filler really serves an important role for
Okay.
lots of patients. And I don't think that surgery is better than filler or filler is better than surgery. It's like, what are you trying to do? And if you're trying to lift something, this is where things kind of go askew. People are like, well, I'm going to put 5 syringes in my face to try to lift it. And it doesn't make sense because, I mean, you're injecting a gel that's soft. How is this going to lift your face? It won't lift your face. Now, if you're missing volume, saying, "Hey, I'm missing volume in my temples or in my smile lines or somewhere else," then you can talk about, "Hey, do I need volume in my face?"
Right.
So I think it's more about fixing yourself based on your anatomical problem. So
Yeah.
I think that's where I keep kind of echoing.
I agree, because I do see, I mean, even with plastic surgery, some of the clients I have, they still need a little filler
Mhm.
because the plastic surgery doesn't improve necessarily on the volume as
And
you're
you can do fat at the same time, which is nice, but I think it's not convenient to always and only do surgery, and it's not convenient to only do filler. They work together, but knowing how they work and what's the best way to work. And so this is why it's like design. You might look at
aging.
something and say, like, is something good or bad? And it's not that simple. It's about making sure it fits the person, it fits their anatomic reason of why they're not happy or they're not balanced, and they all kind of go together.
Just from reading your approach, I really like how you work with your clients, and I feel like if women are going to take this step to get plastic surgery or even start with injectables, maybe, educating them on how to approach the right doctor, what questions to ask. And so I think by you sharing your process, that'll help them understand more.
The first thing I do is I try to find out about the person. Now, it sounds obvious when we're talking about it, but I don't think it's really comfortable for me just to kind of like start operating on someone I don't really know who they are. I need to know like who are they? Who were they? Like what do they want to do? What are their goals? Were they married and divorced? Are they widowed? Have they been married for 30 years? Are they the CEO of a company and they're the face of their glamour brand? I want to know what they're all about. Is this a person who's never done anything and this is the first time they're doing something for themselves? Which is a common scenario. So I want to know all about them. And this doesn't always come up like me asking about things like, like an Oprah kind of, you know what I mean? But it
Yeah.
comes up naturally and organically. So when we're just talking about this part of it, it's this process of like, here we are, let's figure this out. And once we do that, then it's this discovery process of saying, okay, I kind of get an idea, and it's just from doing this so long, what they're kind of like, what their goals are. And then from there, you sort of say, okay, let's see a direction we can go in, which is going to be the best for them. Someone might not be ready for surgery, either anatomy wise or emotionally or all those types of things. And that doesn't mean they need surgery. Surgery isn't the answer for everything, it is
Right.
not. So it's finding out about the person first. And then the other parts, they kind of get plugged in depending on the circumstances.
I love that. And that's why I asked this question because, you know, a woman could be going through a horrible divorce and be like, okay, that's it. I want to go get I want to get a facelift. I want to get my boobs done, a tummy tuck. Who knows? Like I've seen that to where it's like they're just going through a really difficult emotional time. And that the external fix is sometimes what we go to thinking it's going to fix the emotional of what's happening inside. So, I mean, I just love the responsibility of how you approach that.
And sometimes it's like this, like the physical, like the inside and the outside. I
Mhm.
don't think they're completely separate, honestly. I think there's
Mm-mm.
a connection where sometimes to fix the inside, you kind of have to fix the outside and vice versa. So it's not like this really easy relationship between the two of them, where I find that many people that come in, maybe myself included, we're our own worst critic.
Yeah.
And we look at ourselves, we find the things, when we look at ourselves, we find the things that we don't like. We look at those areas. And when other people look at us, they kind of see the totality of who we are. And so we're looking at those areas and saying, okay, what do I need to do to improve myself? So sometimes fixing the outside, it can help us heal on the inside, help us kind of be a better person.
I agree with that too, because there's certain things that if it really bothers you, something really bothers you, and you can fix it and it makes you feel better about yourself. I totally agree that it helps you feel better internally. It's that inner outer connection always, always. And that's when women come to me and they're like, I need help with my makeup, my skin, my hair. I do the same thing. Let's talk about what your diet is, what your lifestyle is, what your sleep is like. Are you moving your body? Because no matter what I do on the outside, if you're not doing okay internally, taking care of yourself, that shows up externally. And then we're not getting to the goals we need to achieve. So it really is that inner outer. But again, if I also teach them how to do things externally that make them improve how they feel, it does give them a bigger little pep in their step and they start to take better care of themselves internally. So
It's all connected.
it is totally. I would love for you to share just some of the experiences you've had with your clients later after they've see their before and afters.
I'll talk about a recent patient. So this patient didn't do anything before the procedure. She'd never done really filler or Botox, just kind of went in. And I get all sorts of patients who've done everything and tried everything, and patients who've tried nothing. It was time for her to do something. And about 3 months later, she told her brother that she was doing something. Husband was happy, everyone's happy, but this was kind of like the whole point of it. She told her brother that she was doing something, but her brother lives like in a different part of the country. So she went to meet up with her brother. And the first time she saw her brother, his first comment was, "Oh, you're back to yourself again." And it was kind of like interesting because it wasn't like she had become a different person, which is what a lot of my patients feel like, that they have become a different person over time, that they hit a certain age and they start to look different. They've been their same person for their whole life up until sometimes age 50 or 45 or whatever that name. And he's like, "Oh, you look like you always have looked." So that's the idea. That's the restoration. And she can see that confidence, that bit of it where she feels like herself, she's back to herself. And that's what it's all about. It's not trying to change the person, it's restore.
Restoring. I love that because most women are feeling invisible once their bodies start changing, once their faces start aging, and not just a little, like when you're in your 40s and your 50s, but when you start approaching like later 50s, 60s, 70s. Um, and that's really about, when they want to kind of get back to who they were, but not look like they were, 30 or 40 again. There's that balance.
For sure. And I think that that part of it is with that. I think it's the best age ever to be in your 50s, 60s, and 70s. It's just the best. I mean, we know so much about health and self-awareness, and the advances in aesthetics are so natural. And I always say this, I feel like I can make a woman look so much younger than I can a guy. You can just make them restored in such a level. And I love giving them that advantage. I like this word age agnostic. And age agnostic means you have no idea how old the person is.
Mm.
And it sort of takes out age as being an issue. And so when you look at someone, you're like, wow, they just look good. And like, how old are they? I have no idea. To me, that's the answer. It's not trying to make someone look 20 or 30. It's sort of trying to make them look like they don't, I mean, they're definitely not old. They just have this, no one knows how old they are. I think what I want my patients to do is I want no one to know you've had surgery. But if people don't compliment you, like just literally give you compliments, then I did not do my job. And if you think about a compliment, like a compliment has to come from inside. And I think a genuine compliment means you look at someone and they look so good that you can't help and say, wow, I don't know what you're doing, but you look so amazing. And that's the best answer.
I just want to take a quick moment to thank our amazing sponsor, Keranique, the go-to brand for women's hair growth solutions. If you're looking for healthier, thicker, more beautiful hair, no matter what hair concerns you have, Keranique has got you covered. Their products are clinically proven and dermatologist recommended, offering a complete hair care system, including treatments, shampoos, conditioners, and supplements to help you achieve stronger, fuller looking hair from the inside out. So whether you're starting your hair regrowth journey or maintaining gorgeous, healthy locks, Keranique has a solution for you. And as a Beauty Shift listener, you get 25% off site-wide. All you have to do is head over to store.keranique.com and use the code BeautyShift25 at checkout. Thanks again, Keranique, for supporting the Beauty Shift and helping women everywhere feel confident and beautiful. So now let's get back to the show. After you have a procedure, no matter what you have, whether it's a treatment or you have an injectable or you have plastic surgery, you start aging the next day. And so I think a lot of people feel like if they have something done, it's like a one and done. Um, I just would love for you to educate people on this, that especially when it comes to plastic surgery, how long does that typically last? I'm sure it varies depending on the person and how they treat their bodies as well. But I mean, do you usually have to go back and get another refresh in 5 or 10 years?
Hopefully not 5 or 10 years. I think in plastic surgery, at least in this day and age, if you're refreshing things in 5 or 10 years, maybe it's not like your ideal outcome. So hopefully you're getting 15 years plus. And I think it depends on the area you're treating. And this is a little bit of the surgeon and a little bit of personal responsibility. So they kind of go together. So you want to maintain your lift. You want to maintain your aging. And that means things like skin care. That means avoiding things that are harmful, eating the right diet, supplements, also that inner self, taking care of that. It's really helpful. If you're under constant stress and you're constantly criticizing yourself, you're going to have a higher level of cortisol. You're not going to sleep as well. You're not going to age as well. Scientifically proven. It's just, so you have to take all that together. And then these little things along the way actually add up to big things. So a lot of patients, if they maintain themselves, can get 20 plus years. But sometimes you might have to do things earlier if you're not as onto it. But most of the people, when they get something done, if you're kind of circling back, it's like this new house you renovated. When you renovate your house and you have this new couch and all the walls are new, no one's going to sit on that new couch with with blue jeans and put their feet on the couch. And you're going to take same with your body. You're going to take care of it because you just invested so much in it.
Right, exactly. And so for people who have had procedures, and this is common, I've seen this, and then in about 3 years, 5 years, it starts to really come back. It really didn't work out the way you planned. Maybe it looked good in the beginning, but then eventually it was like, what happened? I mean, I spent all that money and then, my skin's lax again. Or, I mean, is this common? Are you seeing this in
In
your
my
practice?
practice, I see about 60% of patients have had something somewhere else and it didn't work out. And so you learn to kind of think about things kind of almost like a systems analyst of like, let's do kind of a retrospective of why this didn't work. And this is why I do things a certain way, because I don't want to be that surgeon. I want to be the surgeon who say, hey, guess what? If we're going to do something, let's make sure it's long lasting, because it's not fun to repeat something every 3 years or 4 years and say, I just invested all this time and money in doing that. So if we think about it, you can almost divide it down into specific areas where things are going to fail. So, for example, on an upper bleph, if you don't do a brow lift, it's almost always going to fail here in the corner of the eye, right over in the outer corner of the eye. And think about this: if you grab the skin on your eye, what happens to my brow? It's going down. So as you pull more skin, your brow is going down, and they feel like they have this persistent heaviness. And almost like clockwork, a couple years later, you'll see them back in your office, say, I just did a bleph, and they have this. It doesn't look quite as clean. And if you can support this and then do that, then your eyes are going to work well. For necks, it's pretty common to see a couple of areas. They can see this area over here where the deep neck wasn't addressed. They can see bands pop up. And when you deal with the deeper neck, you can treat those areas, get a much longer lasting result. And a lot of times, if I'm looking at my own work, I'm usually not revising my necks, even 15, 20 years later. It's usually just over time, it's the face and kind of lifting that face back up over time. And it's usually not even a full lift at that point because the neck has been addressed on a deeper level. And if you do that, almost always you don't have to deal with the neck again. It's just sort of you cross that off of your aesthetic list.
Do you do the platysmal bands with the neck? I see that a lot. The platysmal bands kind of popping for women.
I named my neck the 5-layer neck because most people think if they address the superficial layer up to the platysma, they're going to be happy with their neck. And almost always, even if you address the platysma with sutures and other things, you see this recurrence that happens later on, very frustrating for patients. Versus if you treat the deeper layers underneath all of that, you're going to see the neck, this little area with people, no one really treats this, called the hyoid, this going up. Mine used to be much higher, but it goes way up, back up in here. Everything is kind of tucked underneath here, and you're not going to have that separation. Recurrent platysmal bands are really common, really frustrating, and patients they can get kind of upset with them.
You also do you say you're with pain. There's something about you have a very little pain or no pain surgery. Is that correct?
Yeah, so a different procedure, but for facelifts in general, to kind of avoid pain, this is kind of like a general thing. It's hard for face and neck lifts to have zero pain because it's very unpredictable, especially when you're dealing with deeper neck work. So you can have basically a no pain experience if you don't do deep neck work. If you do a deeper neck for a face and neck lift, you can make it so it's comfortable, but still a little bit of tension here. And the way you do that is I avoid wraps. So the wrap, I found universally, everyone hates it. And there's this way of thinking. It's called first principles thinking. And some of the people who think like that way, I'll say it. I'm not like political or anything, but I'll say Elon Musk is like a first principles thinker. And the way you think about things is like, hey, why do we do this? Like everyone just does things, and they just say you have to have a wrap, you have to have drains after surgery. That's just part of having surgery. And if you think about it, like why, like what does a wrap even do? And it actually makes patients recover longer because you're putting pressure here. Blood can't go out of the face. And even if you wrapped yourself on a Friday and looked at yourself on Monday, your face would be puffy. So by avoiding that, putting on this therapy, this little device that's called helotherapy, it's consistent cooling that keeps the patient cool for 4 days straight.
Hmm.
Ice hurts. It does.
Yeah.
If you put ice on straight for 20 minutes, it's not going to feel good. But if
Right.
you put consistent cooling therapy that goes around you for 4 days, you don't have to think about anything. Just kind of hang out with this device on board, and your neck will heal faster and it'll feel better. So lots of these newer technologies that kind of all go together. Hyperbaric therapy is another nice one.
I
That
was just going to ask you about that because I know a lot of people recommend that physicians. It's like rapid healing, right?
It's not as rapid as you think, because everyone thinks if I have a hyperbaric, I'm going to look good in 3 days or 4 days. It does things that this is something we've studied. So it does help you heal a little faster. I think a lot of the other things like the helotherapy actually helps you heal even faster, and the tissue glue helps you heal even faster than that.
Hmm.
And then there's some techniques and things that can help with that as well. But the hyperbaric, what it does really well is it helps your scars look really like on the next level. So if you can get a few sessions of hyperbaric, the scarring that happens after that is like another level of what you're looking at. So that's kind of one of the things, but it does help a little bit with healing. But it's just, I think it's really the little things that it helps do better.
Now, with the scarring, where do women see scarring from, like neck or facelift type of thing? Is that something that they have to cover up a lot? Is the scar really noticeable?
Well, that's like probably fear number one from
Yeah.
having a face and neck lift is like, where are my scars going to be? Because I want to walk around and I want to basically use any hairstyle. By the way, everyone wears their hairstyles up in ponytails now,
Right.
which is ironic because if you have a lift named after that, you cannot wear your hair in a ponytail. And you're like, what? So the question is, how do you basically, like, where do you put scars? So there's a few spots that are really important. Classically, people talk about putting a scar in front of this part of the hair. This is called the temporal tuft.
Hmm.
I don't like a scar there because I don't care what anyone says. Sometimes you have to put a scar there because the way the hair design is or the way the previous surgery. But if you can avoid it, which is on maybe 95% of patients, you can hide the scar here, and in your hair, you will not see your scar. So hiding the scar here, I think, is optimal. You'll be able to wear your hair in the hairstyle you want. No one will ever see that scar. The second scar I like is the one that goes in front of the face. I don't love the scar here. When people put it in front, right on your face, and say, I'm going to hide it in a crease, you can almost always see that. And again, sometimes in photos it's hard to see. Sometimes people will try to fake it with makeup, but it's better. I think it's a little more time consuming to put the scar inside the ear here than on the outside. Again, it's much more technical. You're talking about using super fine sutures that are like finer than your hair to do it that way, but it just looks better. And then the most important difference I don't think anyone really does this. Most people, basically 99% of surgeons, put the scar behind the ear and then in the nape of the neck. So that's the back of the hairline where when you have your hair up in a ponytail. And I know even my patients who are in their late 60s, early 70s, they still wear their hair up when they're working out. They just want to kind of have. So if you put a scar there, you will see it. So I limit the scar. Again, not on everyone. Sometimes I can't, depending on their anatomy, right behind their ear. And there's an expression. If you incise the nape, your hair must drape. And so I think that it's really true. So scar management is like scar planning. And these techniques are really hard to do. You have to put a lot of thought into what you're doing. You also have to kind of talk to your patients and actually talk to beauty experts like yourself. Because when you see patients who get frustrated and say, wow, I really like my neck, but what do I do about this giant scar I have here in the back of my hair? And like, how do
Yeah.
I hide that? And like, can you see it? And you're like, um,
Yeah. Yes. No, I know someone that, yeah, can see the scar. And so you just know that they've had
but
the
what do you tell
facelift.
them? I mean, that's tough. It's a tough conversation.
It is. I mean, you can get makeup now that can cover a little bit, but it's still hard to cover.
I want to eat my cake and like enjoy it too, like they say. So I really want to have all those options for patients. Once you have a scar back here, the only thing you can do to get rid of it is to put like hair in front of it with like a hair transplant. Because if you cut out a scar, guess what happens? You have another scar. And if you cut out that scar, guess what happens? You
Yeah.
have another. It never. It's like this. And it's like a loop that keeps going around. It's like Groundhog Day.
What are some of the questions that you think people should ask a plastic surgeon to really vet them before, they decide whether or not to go to that surgeon.
I think with anything, you should know that that's what the surgeon does. So if you have a Rolex and you want to fix it, don't go to someone that all they like fixes digital watches. Or it's not that they're not a good surgeon, it's that they may not be a good surgeon for that watch. And
Right. If they do all breast augmentations, don't go to them for the face. Yeah.
it's not going to work out well.
Right.
And the faces have advanced so much, even over the last few years, that you're dealing with someone who may be superficially doing lipo, which is wrong, and putting maybe a couple little sutures here, and maybe you'll look good for a few days, and after that, you kind of look the same in 3 months. Or you're dealing with someone. I'll give some examples, like using helotherapy, cold therapy around planting your scar so no one's going to see it. Using an ultrasonic dissector so everything is all sealed in your deep neck, releasing your deep neck. So not only do you look better, you're probably snoring less at night, avoiding the pull, lifting up the deeper tissues, using tissue glue. I mean, you're looking at different levels of different things happening. And so it's not like it's like a facelift is a facelift or a neck lift is a neck lift. It's you have something drastically different happening. And that's why you'll see someone who looks very pulled because they're only losing skin versus someone who looks very natural because they're actually repositioning the anatomy to where it was.
In terms of like after procedures, pre-procedures, I mean, is there certain types of ingredients and things that you suggest women incorporate into their beauty routine?
I'm a keep it simple person. So I'm always less is more. Some of the skin routines from, and I think this is bared out, like some of the skin routines from like the early 2000s, they were like 20 steps. And who has the time to put on like all these different steps and taking things off? And then there's like a pre-treatment, then a post, and it's like 1 hour later, like you're trying to relax and, veg out to Netflix. And then later on, you realize that I'm still have like 10 more steps to go. It doesn't work that way. You really want just that active ingredient on your skin. So whatever those things are. And for me, there's two things I really think are helpful almost universally in everyone. Number one is you want some sort of retinol, tretinoin. I really think that if I look at patients over a long period of time, and by the way, this is the only evidence-based thing. If you look at evidence on studies, that actually helps you look younger. And so women who use it from a long period of time, from their 30s to 70s, their skin just looks different. So if you have one product to use, I would say, let's go for that one. And then what I personally like for myself and for my patients are growth factors. Now, this is there's a variety of different growth factors that are out there. There's like a bunch of them. There's TNS, there's bioserum, there's a bunch of things out there that you can kind of use and incorporate. There's plant growth factors. All of these things are kind of nice to apply to your skin afterwards. And I do think they actually make a difference in making your collagen and thickness and improving all of that together. So I think if you do those two things, you're ahead of the game. If you want to add other things on and say, hey, guess what? I have hyperpigmentation. I have other aspects going on. Add those on and you're not going to hurt anything. But if you do those two things, almost always, you can at least have a good basis for where to start from. And I think it's easier to build with simple things than complex.
I'm the same. It's like keep it simple because the more that we add in terms of ingredients on our skin, then it can really make our skin more sensitive or reactive. But the tretinoin that you're talking about, that I use that. It's a prescription though. It's 0.25%.
There's pros and cons to that. Like if you can tolerate tretinoin, fantastic. Me personally, I can't tolerate tretinoin. So I get this redness reaction. They call that a retinol reaction. They call that retin A reaction. And it's a real reaction because I think the way it's delivered on the prescription one can cause irritation, particularly around the nose and the mouth and around the eye area. And so oftentimes people who use it say, I can only use it 3 times a week.
Yeah.
Mine, I'd like patients to use twice a day with retinol. It's super strong, 1.5%. And I like that because it's delivered kind of in a less of an aqueous base, but more on kind of an oil base. And then it also has microsponges. So it gets delivered over a period of time. It's like taking a shot glass of something. If you take a shot of something, I'm not an alcohol drinker, but I'll use this analogy anyways. It's going to burn. It's going to hurt. And if you do like less potent alcohol over a period of time, it's not going to be quite as rough on your stomach. That's why drinking, I think, a wine cooler is going to be easier. But yeah, that's the thought process. So it usually works out better for patients that way. But if you love tretinoin and you tolerate it well, that works really well.
Yeah, I use it sparingly, and I usually mix it with my moisturizer. So it's a little less, it's not as thick on my skin, just like thin layer.
That's a power hack. Yeah, if you could do that, that's amazing. So that's if you do that, then you're sort of kind of you're making your own version. What you're actually doing is you're making this again more oil based,
Yeah.
and that's going to actually kind of deliver it over a period of time. So you're doing with your product what I do with it straight out of the bottle. But that's a great way of treating it. So I love the way you're doing
Okay.
that.
But it is a good warning for people though, because the prescription strength, I mean, it really, you cannot go out in the sun without, I wear a hat. I make sure I've got at least my SPF 50 and reapply it every hour because your skin is more prone to get damaged when you're using something that strong from the sun. Your skin's
Although
more,
I would say that's true of tretinoin, but less of some of the retinols that are delivered over time. I think
mm,
that's also a slight misconception on products that oftentimes you can go in the sun with them, but that's a whole nother
I think I'm going to order
conversation.
your retinol.
I'll send you some. Try it out and then see if you
I'm
like it.
serious. That's
I'll send some
awesome.
after.
Yes, because I actually was told by a dermatologist years ago if he was, stuck on a desert island and there was only one product, skincare product he could bring with him, it was Retin A. Ever since
Um,
then, I was like, okay.
and I agree, but I think it's just the way it's being delivered, and that's another thing. So
Yes.
try it out and see if it's good and if it works for you as well.
I will. Thank you. Oh my goodness. I could keep you on here a lot longer, but our time is, I know, precious. You've got to get going. You've got a busy schedule. So thank you again for joining us. And how can people get in touch with you? Do you do like virtual appointments with patients?
Yeah, virtuals are like that's the new way, and it's a great way of communicating because oftentimes you can get the information and you can see, when you're working with someone, you want to make sure they vibe with you well. So
Yeah.
that's a great way of doing that. And sometimes they'll talk with the coordinator virtually and me as well, and that's a good first step. So, and they can usually do that through our website, and our Insta is another great way of getting a hold of us too.
Yes, and we will have all that in the show notes. And thank you so much. Great information, so educational, because I think that's what we need. The more educated we are, the more informed decisions we can make.
Well, I'm glad. Actually, I learned from you as well, Michelle, today. So that's a a couple great tips on there. And yeah, thank you so much for having me on here.
Oh, thank you. Wasn't that a great conversation? I actually thought the part where he was talking about the different scars was kind of interesting. I didn't know all of that stuff, but you don't know unless you ask. I would love any questions you have about beauty, health, and wellness. Please send them my way. My website is michellephillips.com, or you can send me an email at info@michellephillips.com. And there on my website, you'll also find lots of great resources on skincare, hair care, makeup, body, wellness, meditations, all things to support you in looking and feeling your best. So until next time, thank you so much for joining The Beauty Shift. Have a beautiful week.
I want to take a moment to thank our sponsor, Carani, for thicker, fuller hair at every age and every stage of a woman's life. I hope you enjoyed the show, and if you did, please feel free to share with your friends, and don't forget to subscribe so you don't miss an episode. And if you'd like to receive my free beauty and wellness gifts, just go to my website, michellephillips.com. I also invite you to join my social media community on Facebook and Instagram, Michelle Phillips Beauty.